Mr. Chairman.
Mr. Stearns, you have an amendment?
Mr. Chairman, I have an amendment at the desk. I think it's Stearns 1, or there's a more arcane naming for it. It's ECR 9T.
The clerk will report Stearns 1 or some other arcane number to it.
Amendment 2, the amendment in the nature of a substitute to H.R. 3200 offered by Mr. Stearns of Florida.
Without objection, the amendment will be considered as read, and the gentleman from Florida is recognized for 5 minutes.
Mr. Chairman, thank you very much. And my amendment goes to the heart of the debate of protecting consumers with keeping their private policy. Now, Mr. Shattuck of Arizona mentioned the quote from Mr. Barney Frank, the liberal from Massachusetts, who indicated that he hopes we have a one-payer system. But you know, that's not what the President of the United States has talked about. In fact, the President said, let me quote exactly what the President said, "If you like your doctor, you'll be able to keep your doctor under our plan, period. If you like your health care plan, you'll be able to keep your health care plan, period." So the President really doesn't agree with Barney Frank, and I think this amendment goes to the heart of this whole policy position of this bill. There's most of the people, I think almost all the people on this side of the aisle, think that it's proper that individuals should be able to keep their current health plan. In fact, poll numbers show that 83% are satisfied with their current health care coverage, and they do not want to be forced into a government-run health care plan. And in their opinion, it could lower quality. It might cost less, but there could be long waiting lines. There could be rationing and a lack of access to life-saving technologies. So I think when the President says that he wants to protect everybody in America by saying they should be able to keep your health care plan, my amendment simply does that by saying, quote, "Nothing in this act shall be construed to prevent or limit individuals from keeping their current health coverage." Now, that's pretty simple. And this is something that I think majority of people on both sides of the aisle should agree with, except for those diehards that agree with Barney Frank that they want to have a universal government-run program. Obviously, the President doesn't, so my amendment sort of goes along with what the President said. I think the President was being sincere when he said he promised to Americans and their families that they'd be able to keep their health care system. So my amendment is a simple statement that nothing in the act shall be construed to prevent or limit individuals from keeping their current health coverage. Now, when you look at Section 102 of the bill, this language would go in and be substituted for that. It's very complex, and I think this would be simple if we had my language, because specifically the Chairman's bill make it almost impossible for Americans who buy their insurance on the individual market long-term to keep that health insurance, even if they like it, by preventing current health plans from changing and adding on to their plan structure, and it forces them to comply with federal mandates that have yet to be determined. So this is a matter of policy, a matter of statement that I think that goes to the heart of this whole debate. Are we going to allow the consumers to keep his or her health care plan? Greater competition is not necessarily the intent we've argued on this side of this legislation. And we feel that with this public policy, people will slowly move into it, either through mandates or through pricing or all kinds of different contingencies into this public policy. And we're saying we don't want the government to put stipulations on the commercial, private insurance plans that would force Americans to move into the public policy. So by creating a federal regulated health care system, government-run, competing with the private health insurance, it won't be long, if we're not careful, that everybody will be moving into the public policy. But it's if we put ourselves in a position that nothing in this health care plan would commit Americans to move into the public policy by mandates, by the pricing of this public policy, I think we're making a statement which is in agreement with the President has indicated. We're actually saying, positioning the government as the umpire pitcher in the health care game. The government is setting the rules, calls the balls and strikes, controls what kind of delivery is offered, so they have a lopsided advantage, and so we don't produce a level playing field. So my simple amendment is following up with what the President promised, what 83% of American families have said when they say, I want to keep the coverage that I have, and it fulfills basically the promise that Americans will be able to keep their health care plan, period. Thank you, Mr. Chairman.